Hello, and thank you very much for inviting me to speak today at UNSA's annual conference. First and foremost, I would like to thank Adrian Marin, your president, as well as Alexandro Cioncan for the great support and collaboration. We really benefit from your input, and I hope we can continue to count on this good and excellent cooperation. You have asked me to say a couple of introductory words about the effect of the current COVID-19 pandemic on the insurance industry and to draw maybe some preliminary lessons. I think first and foremost, it is very important to underline that we can take pride in how insurers across Europe, but also in Romania, have managed to stay strong in the wake of the COVID-19 pandemic. And I give you three reasons for that. First, insurers have managed to ensure business continuity and they have been honoring their promises to customers. Second, they have done all this while keeping their employees safe. And third, they have also maintained a very solid solvency ratio, as underlined now many times by EIOPA and others. Insurers across Europe have also in the pandemic excelled by launching voluntary goodwill and exceptional measures to support their customers. And in Insurance Europe, we have a huge collection of these goodwill measures, and these also include examples from Romania, where some companies have decided to extend risk coverage for pandemics in their life and health insurance policies. Now, when it comes to the preliminary lessons to be drawn from the pandemic, there are already a few, although it's of course very early in the process to draw lessons. But what we can say is that maybe so far it was wrong to focus almost exclusively on costs in our engagement with clients. And we believe that in the future, discussion should definitely be extended to cover. This will become much more important. After all, clear contractual wording is key because it is very clear that insurers cannot provide cover for damage for which they have not received premiums. Then I think another preliminary lesson that we can clearly draw is the importance of fit for purpose and a digital-friendly regulatory framework. As we clearly see in the pandemic now, it was key that we managed to move operations online, and we expect that the pandemic will further accelerate the digitalization of our environment, our work environment, our living environment. And also let me remind you, at European level, the Commission has just presented a very comprehensive digital package to drive these developments forward. Last but not least, also a preliminary lesson, we need to find solutions for pandemic risk coverage. But let me be very clear, these solutions will only be possible with massive involvement by the public sector. And maybe let me a little bit expand on this point. Covering a global pandemic, we have now learned, is simply too great a cost for the insurance market to support alone. I give you one example. Current business interruption premium in some markets would need to be collected for more than 100 years to cover only 2 months of COVID-19 related business interruption cost. Against this backdrop now, we are continuing, of course, to engage with the Commission, with EIOPA, but also with other stakeholders such as, consumer and business organization, to explore how the insurance sector can be part of the solution. And we have, of course, started this conversation by pointing out the dimension and the challenge of this task, and with the clear message that ensuring a pandemic risk is not only challenging, but probably close to impossible. But where we can help is by sharing our extensive experience with risk management techniques and also the expertise in addressing protection gap. However, if you want to address insurability of pandemics, it needs two strong pillars: risk management techniques and risk prevention. Prevention is important as it can make uninsurable risks more insurable. Examples for that are, for example, increased resilience of the health infrastructure. We also need to expand hospital bed capacity, availability of protective equipment, and also increasing the testing capacity. All these preventive measures might reduce the need for stringent confinement measures and lockdown, and that in turn would reduce the risk of disruption and increase insurability. But we also need to be clear there is only so much that preventive measures can achieve. And if we cannot exclude, for example, government lockdown decisions, it means in the end that the risk remains largely uninsurable. Nevertheless, it is an important discussion to have. I am sure your conference today will also contribute to developing ideas and solutions, and I want to wish you all the very best for this exercise today. Thank you very much.